Assalamu alaikum warahmatullahi wabarakatuh. I hope you are doing well. Welcome to MBBS Journey. Let's discuss difference between facial palsy and Bell's palsy. Facial palsy is a supranuclear lesion of the facial nerve, while Bell's palsy is an infranuclear lesion of the facial nerve. As we know, facial nerve nucleus is present in the midbrain, forming facial colliculus. Facial palsy is upper motor neuron type of lesion, while Bell's palsy is lower motor neuron type of lesion. Facial palsy is permanent condition, while Bell's palsy is temporary weakness of muscles supplied by facial nerve. Causes of facial palsy involves infection, trauma, for example stroke, which is the most important cause of facial palsy, and tumor. These are involved the supranuclear lesion of the facial nerve. While Bell's palsy may be due to an idiopathic condition, compression of the facial nerve by inflamed parotid gland, inflammation of the facial nerve itself, herpes simplex virus infection, otitis media because facial nerve passes through the middle layer, stab wound or gunshot injury. Before going to sign and symptoms, let's take a brief overview of functions of facial nerve. Through its motor component, facial nerve supplies all the facial muscles. It also gives motor supply to the stapedius muscle. Through one of its intracranial branches, called chorda tympani, it carries taste sensations from the anterior two-thirds of the tongue. Let's discuss signs and symptoms of facial and Bell's palsy. Bell's palsy involves ipsilateral loss of wrinkles on the forehead, ipsilateral drooping of eyelid, difficulty in closure of eyes, ipsilateral loss of nasolabial fold, ipsilateral drooping of corner of mouth, and drooling of saliva. It also involves loss of corneal reflex and ipsilateral loss of taste sensations on the anterior two-thirds of the tongue. While in facial palsy, there is no loss of wrinkles, no drooping of eyelid, and no difficulty in closure of eyes. But there is contralateral flattening of nasolabial fold and drooping of corner of mouth and drooling of saliva. In facial palsy, corneal reflexes of both eyes are normal, but there is loss of taste sensations from the contralateral side of anterior two-thirds of the tongue. Now come to the reason why such symptoms appear in Bell's palsy. This is because facial nerve supplies all facial muscles and it also provides efferent component of corneal reflex. So when facial nerve is damaged or injured, facial muscles lost its innervation and there is loss of wrinkles, drooping of eyelid, loss of nasolabial fold. Thus corneal reflex is also abnormal in this case. This is a mnemonic to remember Bell's palsy. Now the question arises why symptoms of facial palsy appears only in the contralateral lower quadrant of the face. This is because of the fact that right half of the face is represented by left hemisphere and left half of the face is represented by right hemisphere. Thus symptoms appear contralaterally. And why only lower quadrant is involved? This is because upper quadrant is represented by both hemispheres. Thus upper quadrant is pair of symptoms and symptoms appear only in the lower quadrant. Thus in facial palsy, contralateral lower quadrant is involved. Now the second question is why angle of mouth is deviated towards normal side. This is because healthy muscles contract and lift the angle of mouth towards its side.